Femoral hernia, overview and details. A femoral hernia occurs when tissue, such as a part of the intestine, protrudes through a weak spot in the femoral canal located in the upper thigh near the groin. It is less common than other types of hernias, e.g., inguinal hernia, and is more prevalent in women due to a wider pelvis and hormonal changes that affect connective tissue. Anatomy and pathology. Femoral canal. The femoral canal is a small passage in the groin area that contains lymphatic vessels and a small amount of fatty tissue. It lies just below the inguinal ligament and medial to the femoral vein. Herniation. When the abdominal contents, fat or bowel, push through the femoral canal, a femoral hernia forms. This can create a visible bulge or cause discomfort. Causes. The exact cause is often multifactorial but may include 1. Increased abdominal pressure. Chronic coughing, e.g., from smoking or lung disease, heavy lifting, straining during bowel movements or urination, e.g., due to constipation or prostate issues, obesity or pregnancy. 2. Weakened abdominal wall, congenital weakness, age-related changes, previous surgeries or injuries. Risk factors: female sex, more common due to anatomical factors, older age, multiple pregnancies, family history of hernias, chronic conditions causing persistent pressure, e.g., chronic obstructive pulmonary disease, ascites. Symptoms: 1. Mild cases, a small, tender bulge near the upper thigh or groin, discomfort or pain, especially when standing, coughing, or straining. 2. Severe cases, strangulation, sudden, intense pain, nausea and vomiting, signs of bowel obstruction, e.g., inability to pass stool or gas, redness or discoloration over the bulge. Complications. Femoral hernias are more prone to strangulation, where the blood supply to the herniated tissue is cut off. This is a surgical emergency and can lead to tissue necrosis, bowel perforation, sepsis. Diagnosis. 1. Clinical examination. A physician may feel the bulge in the groin or upper thigh, especially when the patient coughs or stands. 2. Imaging tests. Ultrasound helps confirm the diagnosis. CT or MRI scans, used for complex or unclear cases to assess the extent of the hernia and rule out other conditions. Treatment. 1. Conservative management, only for asymptomatic hernias that pose minimal risk, rare for femoral hernias. Avoid heavy lifting and manage risk factors like constipation or chronic cough. 2. Surgical repair, gold standard. Open surgery. The hernia is reduced and the defect in the femoral canal is closed with sutures or a mesh. Laparoscopic surgery, a minimally invasive technique that reduces recovery time and postoperative pain. Emergency surgery is required for strangulated or incarcerated hernias. Prognosis. With timely surgical intervention, the prognosis is excellent. Delayed treatment of strangulated hernias can lead to severe complications, including death. Prevention. Maintain a healthy weight. Avoid activities that strain the abdominal muscles excessively. Treat chronic conditions like cough or constipation. Strengthen the abdominal muscles through exercises. If you have any further questions or need information tailored to specific cases, feel free to ask.